Hi, I'm Andrew Miller, and I'm here to talk about my favorite pediatric articles from 2022, Part 2. We couldn't fit all of the articles I wanted in Part 1, so now we're doing Part 2. A little bit about me. I'm a section editor for respiratory care. I'm also a pediatric RT and ECMO specialist at Duke University Medical Center, and I've received honorariums from SACS Communications and S2N Health. So my favorite pediatric articles, I already talked about my first 5, but there were so many good pediatric articles published this past year that I couldn't keep it to just 5. So now I'm going to talk about my second 5. The links are in the descriptions if you want to read the full paper. Yeah, the first study I want to talk about is a Delphi survey from our colleagues up north in Canada on how pediatric RTs agree with some practice statements on pediatric mechanical ventilation. So they evaluated how well the RTs agreed with expert recommendations from various societies. And you can see here a nice flow chart of how they did this study. And then they were able to notice that the consensus was achieved after 3 rounds, which indicates that RTs generally agree with current consensus recommendations for pediatric mechanical ventilation. The second study we're going to talk about is a RT-driven ERT protocol in a PICU from Singapore and from Hung Lee Tan and colleagues. And what they found is that implementing an RT-driven protocol resulted in reduced time on mechanical ventilation, reduced time in the ICU, and fewer reintubations. And you can see here a nice flow chart of how they did their QI study. The next study I want to talk about is Heliox prescribing trends for pediatric critical asthma. So what we know is that Heliox is used quite a bit, but we don't really have really good data to know when to use it. So what Dr. Liu and colleagues did is they looked at this large database, which is the VPS, or the virtual PICU database, and they actually looked at all the different centers that used Heliox, and what they found is that, unsurprisingly, Heliox use varied substantially between centers. But kind of surprisingly, they noticed that Heliox wasn't associated with a decreased need for mechanical ventilation. So the places that did use it didn't seem to show much benefit. Or if you received Heliox while you're on mechanical ventilation, it didn't seem to have any effect on how long you stayed on the ventilator. And the fourth study, or the second to last study we're going to talk about, is a study comparing non-invasive ventilation versus nasal CPAP for prevention of extubation failure in infants post-cardiac surgery. So this was a single center randomized control trial, and they compared nasal CPAP to nasal NIV in infants, mostly had ASD and VSD, so relatively low risk surgeries. And then you would, what they found is there was no difference in reintubation or duration of therapy, which you can see here, but importantly there was better gas exchange in the NIV group, so they had a higher PF ratio and lower CO2. And last but not least is a study from Rogerson and colleagues looking at the frequency and correlates of pediatric high flow nasal cannula use in 3 disease states: bronchiolitis, asthma, and pneumonia. And what they found, using a very large database for the state of Indiana, is they found an increased use of high flow nasal cannula for both bronchiolitis and asthma. But it's unclear if this expansion is really warranted because we don't really know how effective high flow nasal cannula is in these various patient populations. So you can see here, high flow nasal cannula use is going up, started to go back down in 2019. Importantly, and you can see here, and this graph shows very well, that the rates of use for pneumonia have gone up a little bit, but the use for bronchiolitis has gone up dramatically, almost doubled from 2017 to 2018, and then has essentially doubled for asthma as well. So much more use of high flow nasal cannula for these kind of unproven disease states, and maybe we're overutilizing high flow nasal cannula a little bit. So thank you for listening. You can follow us on Twitter, you can follow us on Facebook, and please subscribe to our YouTube channel. Thanks for listening.